name is Peter Fine. I'm a Senior Clinical Teaching Fellow here at the Eastman and an Honorary Research Fellow. Well, the RDP programme basically is a programme that allows postgraduate students to come in and hone their skills and their knowledge so that they can then take very everyday practical skills back to their practices and to work on their own patients with those new skills, with those enhanced skills.
The disciplines for the restorative dental practice programs are prosthodontics, endodontics, periodontology, as well as integrated total patient care. This program addresses and integrates all these 4 disciplines into total patient care in order to deliver a very high standard of patient care to patients.
Certainly they can work at the same time as they're learning, and this is one of the strengths of the programme. As a part-time programme, they come in probably on average twice a month.
I graduated from dental school about 10 years ago, and I had done a range of smaller courses but nothing structured. I was looking to improve all aspects of my general dental care, not to de-skill in areas, because I work in a specialist practice where it's quite easy to start referring things away and de-skill that way. I'm also a mum and I had taken a bit of a gap, so I thought it would be nice to go back knowing I can still give my patients my best and build on knowledge and actually implement things as I'm working. I think there's a huge emphasis on hands-on at the Eastman, and dentistry can be quite isolating in that you spend your time in someone's mouth the whole day and rarely see someone else's work. So this is nice because everyone's quite approachable, quite understanding. There's different levels of skill, different exposures in their clinical practices. So because we're here quite regularly, you actually speak with your peers about what they may have done, what they found difficult or more easy, what they've changed. And I think that helps you reflect on what you're doing also. So I think one of the things are the structured nature combined with small assessments along the way that keep you on your toes a bit.
So you have got 3 stages: the certificate stage, stage 1, the diploma stage, stage 2, and the MSc Master's stage, stage 3.
The certificate program is a 1-year course. It's run 3 days of the week, so it's very flexible. We run it on a Monday, Wednesday and a Friday. Actual days consist of having students come in the morning from 9:30 to 5. We have a seminar, small group teaching. We also then have simulation modules and actually in the skills lab downstairs. I think the certificate year is a really great year to be in. You know, you get a group of students, when you're usually in practice, you kind of feel isolated. At least when you come here, you're coming in regularly, you get a group of students that you work alongside. We have a really friendly atmosphere.
The diploma part of the course is an extension of the long-established certificate year. Our students make a clinical logbook of cases. So the requirements are that they attend and they learn and they pick up the skills, but also what they're doing is we're trying to get them to apply the skills they've learned in their clinical practice and show us actually what they're doing.
So the 3rd stage, once you've completed it, the Masters, you get a full Masters of Science in Restorative Dental Practice from the Eastman.
I think firstly, virtually everybody who completes the programme has a lot more confidence in what they're doing and competence. So that's one major feature. I think the other aspect to it is that particularly with some of the younger practitioners, what it gives them is a tremendous base to then develop their career. They become more marketable. They are people that other practitioners want in their practice. They've got something a bit extra, they've got something a bit different than the average practitioner has got in terms of knowledge and skill.
A few of my colleagues have been on the programme previously. I was looking for a programme, so I looked at various different universities doing a similar thing, but obviously you want to go with someone that's been recommended. It's definitely made me think differently. Going on from 25 patients a day, I'm now seeing 10 patients a day, but I feel that I'm getting much more out of my dentistry. It's to make sure that my patients are getting treatment which is not just cosmetically orientated, but they can function properly, they're happy and they recommend me, and it helps grow my business as well. And that's what I hope to get out at the end of the whole programme.